Many people are asymptomatic, don't know. Over the last year, it appears to be at least a 25% increase in numbers that we are testing. And of course, the more we test, the more we're going to pick up.
Okay.
The specialty clinic will test for syphilis, HIV, hepatitis C, the blood work. Syphilis is probably the most complicated one to address, but we do our best.
The increase in cases have been dramatic. I see babies born to parents with syphilis, babies who are suspected of having or who were ultimately diagnosed with congenital syphilis. Nationally, we know that cases have really increased from 335 cases in 2012 to more than 3,700 cases in 2022. Congenital syphilis, at least, used to be rare in Kentucky. We are seeing many more consults, a request to evaluate babies born to people with syphilis diagnosed during pregnancy.
Kentucky was like 22nd in the nation for the number of congenital syphilis cases, so we know it's a problem. In this laboratory, we do a variety of tests to support public health programs and our community partners. On average, it's anywhere between 7% or 11% positive. And then when we move those to the confirmatory test, then it's more like 60%. Because Louisville, we're the largest urban population, have a very diverse population, we tend to have more than half of any of these cases.
Many babies with congenital syphilis look normal at birth, but they can go on to develop serious health complications, problems with vision, problems with hearing, problems with development. And so that's why it's so important to test pregnant people at the time of delivery so that we can identify pregnant parents who've not been treated and then treat their babies, because syphilis is a very treatable infection. It's cured with penicillin.
A lot of times people think, oh, it's nothing, it doesn't hurt, it goes away. They don't realize they have syphilis. They can develop secondary symptoms, which include a body rash, chest back, usually if it's on the palms, it's on the soles of the feet.
Anyone's thinking about becoming pregnant or they are pregnant, that definitely get screened for syphilis as early as possible.
You don't have to have any symptoms or have any problems to come here. Sexual health is a part of health. There's a multitude of symptoms that a lot of people won't even realize that is associated with an STI, especially if it's months later.
It's pretty quick in the laboratory to get an answer back to their provider. So I think raising awareness.
We most definitely are looking for it. Someone delays treatment for too long, it can certainly lead to other problems. So the sooner you get tested, the better.